Looks like stock futures are setting the stage for a pretty nice rally on Wall Street this morning, despite a surge in the number of coronavirus cases around the world this weekend. First, let's get to those numbers for you, where we have Dow futures now up 125 points. In the broader market, the rallying continues. We've got NASDAQ futures up 75, S&P futures up about 19 points. Meantime, the World Health Organization this weekend reported the largest one-day increase in infections across the globe since the pandemic started. It said there were 183,000 new cases, with Brazil and the United States accounting for most of those new infections. The virus has now sickened nearly 9 million people worldwide, accounting for more than 466,000 deaths. But as more states reopen, it looks like investors are betting on an economic recovery. We have New York City beginning phase 2 in its road to reopening today. For the first time in months in New York City, people can now eat outside in restaurants. You've got barber shops and salons open at 50% capacity, but open nonetheless. And also, in a sign of things coming back to some kind of normal, Macy's has announced it's reopening its New York City stores, including its iconic flagship store in Herald Square. And of course, there is a lot of attention on testing throughout all of this, especially after the president's surprising comments during his rally in Tulsa this weekend. He said he told health officials to, quote, slow the testing down. Let's talk about this now with Dr. Anand Parekh. He is Chief Medical Advisor at the Bipartisan Policy Center and a former Deputy Assistant Secretary at the Department of Health and Human Services. Doctor, it's good to see you again. Thanks for being with us. I want to begin with these comments from the president. I should note the White House is actually saying the president was just joking when he said they should pull back on testing. But what do you make of what he did say? And is the spike in cases simply because we're seeing more rigorous testing?
Hi, Alexis. Good to be with you. I think whether the president said it in jest or whether he was serious, it's a pretty terrible thing to say, because we know that testing and contact tracing are absolutely critical to suppressing the virus. And I think what we're seeing in many states across the South with an increase in cases, they're actually not testing enough. We know that because the percent of positive tests are actually quite high. So I think it's really, really concerning. I think the last thing I would say is if you look at countries around the world, as you test over the long term, your cases should actually come down because you isolate cases, you quarantine contacts, you stop chains of transmission. So testing should actually ultimately bring cases down. So I'm very concerned about the trends, particularly, again, across the South, and testing by itself certainly doesn't explain that we're still in the first wave of this pandemic.
Doctor, are you concerned about super spreader events as President Trump goes out there and does hold campaign rallies, but also I imagine Vice President Biden will eventually start holding rallies as well?
I am. Any type of mass gatherings, particularly indoor, Brian, where there's not social distancing, particularly where people are not wearing cloth-based masks. The evidence is accruing about how important that is to reduce transmission. So anytime that you have a scenario like that, it's certainly something to be concerned about.
Doctor, to your mind, what do you see happening in the next few weeks? We've got places like Arizona, Texas, now Florida being called the new epicenter. Cases there continue to rise, although overall, are hospitalizations on the decline? Because is that really the number we should be focused on as opposed to numbers of overall new positive cases?
It's certainly a good sign that hospitalizations are down, deaths are down. The surge on our healthcare system is down. I think that's all good. But we know very quickly, Alexis, that cases can explode and the healthcare system can get overwhelmed very quickly. And that's, I think, the concern across the South in states like Arizona, states like Texas, as well as Florida. I think what we really need to see right now are really three things. Number one, a commitment, dedication to testing, as well as the flip side of that coin, which is contact tracing. Second, the courage to follow the data. I think evidence-based decision-making, we're all talking about reopening, but if the numbers go in the wrong way, who's going to have the courage to reinstitute some of these policies, to do a pause? That courage is going to be critical. And then third, Alexis, it's a commitment to social distancing and the use of cloth-based masks. And that really starts with effective leadership and communication so the American public understand that though we've made progress, nothing has fundamentally changed with respect to the virus. It's a highly transmissible, lethal virus for which few of us have immunity, and we don't yet have a vaccine.
Doctor, what's your reaction to those lawmakers? And I think there are a good number right now, especially the governors, willing to keep their states open as they see cases rise, on this view that, all right, we'll get through this. All right, maybe 100 deaths is okay, that's okay. But people are still dying out there.
So many of these deaths, Brian, are preventable. And I think you have to use an evidence-based, data-driven approach here, really looking at cases as well as hospitalizations, making sure testing continues to go up. Contact tracing, less people talk about that. That is so important to opening up, Brian, because that's the way we break chains of transmission. So again, I think, we can't pit health versus economy. Economy doesn't fully come back until we can suppress this public health pandemic.
Doctor, are you hearing, I've read that there are reports that the virus this time around is now affecting younger people, more people in their 20s and 30s. And I'm also hearing that there may be a new strain of the virus in Beijing at the moment. Have you heard anything on either two of those points?
Alexis, I haven't heard anything about the latter. In terms of the former, however, I think it's particularly young people who perhaps are not getting the message that we are not yet over this pandemic. And I think mobility is increasing. More and more young people are out there and they're contracting the virus and they're transmitting the virus. And that's why, I think we're seeing, particularly across southern states, spikes in cases. So I think, again, it comes back down to building trust, effective communication, particularly to all those young people out there, that you too can get COVID-19, you can get sick, and you can transmit it to those who are high at risk for severe complications.
All right, we have to stay vigilant. That is definitely the message here. Dr. Anand Parekh, thanks for being with us.
Thank you, Alexis. Thank you, Brian.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.